Okay, it looks like we're live. Welcome to USC Facebook Live. My name is Kayla Delahaye. I'm an associate professor of population and public health sciences at the Keck School of Medicine of USC. And I'm joined by Gary Painter, who's the director of the USC Price Center for Social Innovation and of the Homelessness Policy Research Institute. And we're here because we've each been involved in some new research on two related issues, food security and the social safety net. And these are issues that are important to families in Los Angeles, but also to families throughout the country. And so we're grateful for the chance to share some of the results of our work with you. And also, just thinking about the timeliness of this conversation, over the next few days, we're going to recognize World Food Day and also the International Day for the Eradication of Poverty. So these are moments when people around the world can take stock of some of these issues and shine a light on them. So with that short introduction, I'm going to turn it over to Gary to kick things off.
Thank you so much, Kayla, and good morning, everyone who's live with us, and good day for those who are going to join us at another time. I also want to add to our conversation that this is timely because there's a large infrastructure bill, sometimes called the Human Infrastructure Bill, which is being debated in Congress right now, to think about what the social safety net should look like for low-income individuals and families in America. And perhaps, with this context in mind, Kayla, maybe it'd be helpful if you could define what food insecurity means, and how do we define what it means to be low income or poor in the context of the work that you've done?
Sure. So I'll start off with food insecurity. I think when people think about food insecurity, they usually think about people feeling hungry, but it really refers to a situation where people change what they eat. They might eat less food, or they eat different types of food, often less quality food, because they are lacking money or other resources to be able to get enough food.
Mm-hmm.
And the other thing to note with food insecurity is it's a state that people transition in and out of often. So it's really common for households, say at the end of the month when they've just paid their bills and they're running low on funds, to have experiences of food insecurity, or at certain times of the year when they have a lot of financial demands, often around holidays, or if there's a health crisis. That's often when people have experienced that state of food insecurity. The other thing to note is, I think we often think about this as a problem in other countries, but it is a really common issue in the United States. In a typical year, which obviously wasn't the last year and a half, about 1 in 10 households experience food insecurity in the US. In LA County, we usually track this just among low income households. So households who are defined as 300% or lower than the federal poverty line based on their income and number of people in the household. So when we look at just that group in LA County, in a normal year, about 1 in 4 of those households experience food insecurity. And why we get worried about this, there's a lot of reasons. One, we live in a wealthy country that has plenty of food for everybody, and it's just not reaching people. In fact, we throw out and waste a lot of that food. And the other reason is, thinking from my public health hat, food insecurity is bad for our health. So for both kids and adults, people that experience food insecurity tend to have worse nutrition. They use more shelf-stable foods. They don't purchase expensive fruits and vegetables. They have worse mental health and sleep often. And food insecurity actually increases people's risk for diet-related diseases like obesity and heart disease. So that's food insecurity. And I want to turn it back to you, Gary, maybe to speak about the issue of poverty and low income, and really how that relates to your work on the social safety net. So how does the social safety net support low income working families? It seems really complicated. And so some of the questions that pop up for me are like, who qualifies for benefits? What about the social safety net do we understand pretty well? And what is surprising?
Yeah. I appreciate those questions. And I guess I was wondering if you'd want some of the good news or the bad news first as we address some of these questions.
Hopefully a bit of both.
Okay. Well, I'll start with the good news, if you will. The social safety net over the last 2 decades has expanded in ways that do provide resources to low-income households that can provide them the equivalent of a living wage if, and this is unfortunately the big if they qualify for all of them and receive all of them. And this gets to perhaps the bad news side of the coin, is that to qualify for the full set of our social safety net programs, you have to actually be extremely poor. So earning, in some cases, less than 10, 12,000 a year. And you can't have assets and for many of the programs over $2,000 or $3,000 a year. So in order to qualify for what can be a full range of support, you have to be extremely poor. Another piece of bad news, despite the fact that, if you qualify for everything and receive everything, you actually can get sufficient resources. Only 1 in 5 actually receive housing assistance, which is probably a third of the full social safety net. So it's pretty clear that 4 in 5 people who are eligible and would qualify from an income and asset eligibility standpoint just simply don't receive them. And a third part, and you mentioned a little bit, it's really complicated. And it's actually gotten more complicated even as the social safety net has gotten stronger. So it's kind of a little bit of a good news, bad news on that part. The way that the social safety net has gotten stronger is that now the tax code provides a lot of support for low-income working families that it didn't used to through the Affordable Care Act around healthcare tax credits for children, child tax credits, and child care tax credits, so that when they actually lose some benefits along the way as their income moves up through working, they get replaced by these tax credits. And what's a real challenge for us, what we practitioners on the front lines actually don't appreciate, is the link to these tax credits. And that's something that we have to get the word out on and appreciate that for how critical those tax credits are going to be to keep the resources supporting families high enough that they can actually live and function and pay for the necessities that they have.
Sounds like it would be really hard for a family to just work all those details out, even for community-based organizations that might be helping people do that.
Absolutely. And maybe toward the end of our conversation, we can talk a little bit about maybe what innovations needed to get us to the point where you don't have to have the knowledge yourself, but maybe, there are going to be system actors or perhaps even one day an app that can do a lot of this work for us, just to simplify these things for us. So the work that my team at the Spice Center for Social Innovation was looking at was kind of trying to characterize kind of what the social safety net looks like for working families right now. But your work actually placed a really stark focus on what was happening in the pandemic. And I think many of those in our audience are really interested to know, like, what has changed for low-income families in the pandemic? How has food insecurity shifted? And could any of the responses in the pandemic actually give us hints on what we ought to be doing in the future?
Yeah, so yeah, you're spot on. We were really hyper focused on how the pandemic impacted some of these issues related to low income and poverty, specifically food insecurity. So we have a team at USC that's been working with the County of Los Angeles, who was also really concerned about this issue when the pandemic hit. And we've been working together with some private partners to track food insecurity during the pandemic. So we're fortunate to have a big panel study at USC called the Understanding America Study. And so this is a big sample of people that are representative of households in LA County. And so we were able to use that to, throughout the pandemic from April 2020 until July of this year, track food insecurity and how it was changing. And what we found is that there was a huge spike from April to December 2020. 1 in 3 households in the county, that's about 1.2 million households, experienced food insecurity. And this is way higher than what we've seen historically. Also, as we were tracking it, week to week and month to month, we found it was really at its highest in the first few months of the pandemic, like when the crisis hit and the chaos was happening and people were losing their jobs. That's really when we saw it spike. And then it dropped down since then. And we've just looked at data from the first 6 months of 2021. And we're seeing that rates are much better, but still 1 in 10 households in the county have been food insecure in the first half of 2021. So there's still a lot of work to do. But I think you're right. We have learned something from the pandemic about, what worked in that response. We spent a fair bit of time looking at, who is most at risk for food insecurity. And, as expected, it's folks that have low incomes or are living in poverty. Also people who lost a job and are trying to work out this system right after and get benefits or find resources. Food is often kind of the last thing on the line that gets covered once you have all your other bills and things paid for. We also saw single parent households were at a higher risk for food insecurity, and younger adults. So we were looking along with the county to see, what was happening. The landscape of assistance was changing a lot. There was new programs, and people on the survey reported using a whole bunch of different things. So they were signing up for government programs. They were going to food pantries. They were telling us they're getting help from family and friends to help with food. But what we did see is that the largest government food assistance program, called CalFresh in California, but known nationally as the Supplemental Nutrition Assistance Program, or SNAP, that program really helped to lower people's risk for food insecurity during the pandemic. Households that got this assistance in LA County were 20% more likely to transition from being food insecure to food secure compared to households that didn't get it. But what I think is really in line with some of the work that your team has been doing is that we saw a lot of people not getting these benefits. So just 1 in 4 people that were food insecure during that first year of the pandemic were even getting CalFresh. So lots were navigating this issue without that benefit. And from our analysis, it looked like a lot of folks would be eligible for the program based on their incomes at least, but were not enrolled. So there seems like, there's gaps to fill. We know that this program works, and there's room for improvement in terms of getting people linked up to it.
I know, just to follow up on that point about people who may be eligible but not receiving it, I know in our work we saw that immigrant families are not eligible for the full range of benefits, but CalFresh, I believe they are. Was there any connection to immigrant status and not receiving the benefits?
Yeah, we have talked to our county partners a lot about that. And, I think it's a complicated issue because a lot of families have been worried about the public charge issue. And so there's been a lot of communication by the county, essentially saying like, the rules have changed. A lot of people think they're not eligible when in fact they are. And so, trying to put the message out of like, don't rule yourself out of these benefits, like give us a call and we'll help you work out if you qualify. So I want to also ask you about some of the things that are coming up in your new findings, Gary. I know you just released a new study this week as well, looking at benefits that are available to people and the safety net more broadly. And I'd love to hear a bit more about some of your key findings. And in particular, I know you look at the issue of benefit cliffs and resource plateaus in your work. And so I'm curious why, what you found and why you're interested in looking at that issue.
Yeah, I think in many ways that this term benefit cliff, which is one that's not well, used broadly, and probably many people in the audience have never heard it before. But it's a phenomenon that people who are receiving public assistance in one way or another actually are afraid that if they earn an extra dollar or maybe $100 or $1,000, that their benefits will actually not just be reduced because of that income, but perhaps could fall out and disappear altogether. And so this term benefit cliff began to be used in the public parlance around our social safety net programs. And in many ways, what motivated this work, which was in partnership with our, as we often do at the Price Center, we work with community partners. And in this case, we worked with Imagine LA, is that a lot of their clients were just straight up afraid. Like, I don't want to work more because I could lose my housing, I could lose my childcare, I could lose these things. And in part, it remains true that benefits do sort of start to fade out as your income goes up, and that would be expected. But what people didn't appreciate, and I mentioned earlier, is that the tax code actually, in some sense, changes a cliff to a plateau. So what was a cliff where you could lose your Medi-Cal Now you have the Affordable Care Act to kind of soften that blow. And so you actually do still receive subsidies toward health insurance. In the same way, what was a child care benefit associated with our program in California, CalWORKS, which broadly is the temporary assistance for needy families program in the country, that child care benefit starts to transition into a child care subsidy vis-a-vis the tax code. And so what we see, instead of benefit cliffs, that it or would be also a resource cliff, you still see benefits being reduced as you earn more, but the tax code actually helps soften that blow, so that a family, again, if you qualify for everything and importantly receive everything that's available to you, if you were that poor to begin with to qualify for that, you actually, from the time you earn around $10,000-$12,000 to the time you earn $60,000, you have what I would call a resource plateau, in the sense that you're going to continue to be supported by the tax code, by benefits, until your earnings get above $60,000, $70,000. And so in that way, that's part of the good news in terms of what we uncovered. But the challenge is to get those benefits, those tax credits to people in a way that they can understand it clearly. One of the things that may be a surprise to people who don't work in public health in general, or health in general, is the fact that you said that food insecurity is linked to certain diseases that you may not have fully appreciated, like, for instance, obesity, other mental health challenges that people might be experiencing, which might be a little bit more obvious if you're worried about food insecurity. Maybe you also have that stress that could lead to mental health issues, but perhaps I'm not asking the question or posing it correctly. What is that link? And what can be done about it? Maybe it's all you need is to really address the food issue, but is more needed to address those issues?
Yeah, definitely. So yeah, it is sort of a surprising link that we think, okay, people who don't have enough food are at higher risk for obesity. And this has really been borne out in a lot of research over the last few decades on food insecurity. And the link is really that, it's really part of this bigger poverty cycle of, experiencing food insecurity and not having enough money for food. When we talk to families that had this experience, especially during the pandemic, families were saying they're really mindful about, okay, how are they spending their dollars during the pandemic, especially like if they're relying on public transportation or their kids are at home. So they're, planning out, okay, every 2 weeks, I'm going to go to travel to that supermarket with my kids, try to buy like really cost effective food, probably shelf stable food that is going to last me out for the next couple of weeks, that is as cheap as I can, find, that, it will stretch my dollars. And, you can sort of understand how people are getting into a pattern of maybe eating less fresh fruits and vegetables, maybe cycles where they consume more when they have money available and then less when they don't. And so what we found is like really that cycle leads to poor nutrition. And it does put people, adults and kids, at a higher risk for obesity, as well as diabetes, heart disease. There's a lot of diet-related diseases linked to this issue. And then so you can imagine how that plays out in this poverty cycle and with all the other challenges these families are trying to deal with. It. You've been talking about this creates extra healthcare costs associated with diabetes or going to the doctor, or a heart attack that might, you might be at higher risk for. And those healthcare costs are detrimental for families. Even the cycle goes as far as, having a health crisis tends to put families into a state of food insecurity because they might not be able to go to work, and the cycle continues. So there's a shift right now. And we've been really focused on food insecurity, about just getting people enough calories. And so there is a lot of folks, community partners, folks that work in this issue in public health, thinking about nutrition security. And, we definitely need to get people enough food, but we should also think about getting people access to healthy food and being able to eat in a nutritious way regularly.
Yeah. That makes sense a lot. I just want to let our Facebook Live audience know that we have about 10 minutes left. If you have questions, please put them in there and we'd be happy to address them. I want to ask at least one more question before we get to audience questions. Kayla,
I've got one for you too, Gary.
Okay, that sounds good.
Can I jump in?
Sure, go ahead.
Well, because I wanted to ask you a bit more about, LA in particular. There's people living in poverty face so many challenges, and it does seem like affordable housing is such a key issue related to all of this. I mean, we certainly see with families that are food insecure, like money is going to rent or to keeping their home, and they'll go to the food pantry to be able to to keep paying their rent. And so it seems so interconnected. So I'm curious what your research has shown on innovative ways of addressing housing affordability and homelessness, and working through some of these issues of affordable housing.
I appreciate the question, and food insecurity and housing insecurity, just in the same way that you described the connection between health and food insecurity, are quite close. We've done some research, and it's available on our website, where we surveyed 800 households within South and Central Los Angeles and asked them questions about, given their level of housing insecurity in terms of how much of their income was going to rent. And so these are people who are actually housed. How many people were making trade-offs, in other words, cutting expenses in other places? And as you noted, many people, once you start paying more than 30% of your income in rent, are cutting back on food. And it becomes even more pronounced if you're paying more than 50% of your income in rent. And what we know in Los Angeles is that over 30% of the population who are renters are paying more than 50% of their income as rent. This is a huge issue.
Wow.
I already noted that if you receive a housing choice voucher from the federal government through our public housing authorities, then you're covered, and then you may have enough support to actually navigate what resources you need as a family so that you won't be housing insecure, food insecure, et cetera. And noted that 1 in 5 don't get anything. And I think that's what's so painful, right? Is that if you have 70 to 80% of the population eligible but not receiving anything, then what do we do? And so that we have seen in research, there's a direct connection between that stress and people experiencing homelessness or doubling up or living in their cars. And to that end, the sad feature right now is that our systems only support with some kind of smaller levels of housing assistance if you've gotten to that stage. You have to be so destitute. Again, this is unfortunately a feature of our program in the US, is that you have to be on the verge of or experiencing homelessness to get not necessarily a housing choice voucher, but perhaps a time-limited voucher through a program called Rapid Rehousing. Or you might receive some permanent supportive housing support that is a little bit more long-term if you have chronic conditions that have led you to becoming homeless. There are shallow subsidies that have even been talked about. But it has been uplifted that if we can't get all the way to an entitlement voucher program, which would eliminate the 70 to 80% of people who are still waiting but eligible. Presidential candidates at the time, Kamala Harris and Cory Booker, suggested doing a renter's tax credit, which would kind of be parallel to the mortgage tax credit that homeowners get. And you could imagine that being quite supportive for people who are paying half their income as rent, and really reduce the insecurities that they face both for housing and for food as well. I know during the pandemic, we heard all about some creative solutions where, restaurants who didn't have people coming to the restaurants were working with schools to help provide food and so forth. We also received some, from the federal government, more resources than we had in this space to support food needs more broadly. What sort of innovative programs have you seen that could then be models for us going forward to further reduce insecurity in our populations?
Yeah, I mean, we saw so much kind of creative problem solving during the pandemic. I mean, I think it was a challenge for a lot of folks.
Mhm.
And this actually relates to a question I think we just got in from one of the audience members on Facebook, asking about was there grocery delivery happening to people in food deserts or people who were food insecure? So, yeah, I mean, we have these great government programs like CalFresh that work. But one of the things our team was really thinking about is the complexity of the food system. So people live in very different food environments. Some people live in food deserts where they don't have good access to grocery stores and supermarkets. And on top of that, they rely on public transport, which is really scary during a pandemic. And so, what we heard from people is that they faced a lot of challenges related to this, like getting a lot of folks that were food insecure that we surveyed in LA County, half of those folks that were food insecure said they couldn't get groceries delivered.
Mm.
And it was for a lot of reasons: cost, maybe living someplace where it's just not feasible to have food dropped off on your front doorstep. But, there were innovations happening in that. We saw the county government stand up a program called Great Plates, where they were getting restaurants and other pre-prepared food delivered, especially to seniors who they were especially worried about being socially isolated. Homeboy Industries had a program where they were delivering food out to folks. But I think there's a lot of innovation that can still happen in this space about, thinking about making healthy food accessible to everyone in the county, both, accessible in terms of the space, but also affordable and culturally appropriate and foods that people want. We've been working with Yelp and another data partner called findhelp.org. And they have really helped us thinking about what some innovation could happen here. They've been sharing data sets on the food environment in LA County and how quickly it's changed during the pandemic. We've used Yelp data to understand where food outlets were closed at different times and where food access became more difficult. And the Find Help data allowed us to look at where all the food pantries were in the county. And, thinking about what are the areas of really low access. Is it, who is going to respond? Is it going to be a combination of private partners with government that are really going to say, okay, how do we get food, especially in a crisis, to these areas in need? I also want to ask you, Gary, I know like your institute really thinks about innovation in this space too. And, from your perspective, what are some of the innovations that could happen, post-pandemic and moving forward to address the safety net?
Yeah, I think it becomes quite clear, and hopefully our conversation today has also emphasized this, that this is an incredibly complicated, kind of morass of, multiple programs. People might need 15 different programs or qualify for them in order to actually support the necessary resources to live here in Los Angeles. So we think that we have to do something better, and we have the technology to do that so that we can have frontline people who are providing support, caseworkers in the county, nonprofits, et cetera, that have the ability to basically just click a button and to know what that family is eligible for, and to make sure that they could trigger like applying for all benefits kind of in a one-stop shop. That's something that could be done. There are ways that I'm starting to see some interesting work around social entrepreneurs trying to envision like a benefit calculator for people. Again, you could imagine it becoming an app. It could be on a website. It could kind of work out scenarios, not just for if you're earning 10,000 now, but you're earning 40,000, you hope to have a job that pays $40,000 a year from now and 70,000 2 years from now. What is the trajectory of change? Like, what would you expect? What benefits support you along the way? There was a question from one of our Facebook Live audience members that said, what is the most important benefit? And if you hadn't guessed, it is housing. And the second most important benefit is childcare. Our social safety net is constructed, especially over the last 20 years, to support working families. If you are trying to work and you don't have childcare, it doesn't work. The safety net is once again broken. So you have to receive housing, you have to receive childcare. That is actually, and people may not fully appreciate that, that comprises more than half of the resources necessary to be a working mother, a working family, a working father, to support your kids. And so if you don't get those two, and then there's no way that you can get to what you need.
Yeah, that's interesting. I know CalFresh is one of those few programs where it is available to folks without kids, and it really ends up being a mix of people that get it, but it's not that much money, and it's just for food.
Yeah, that's a whole nother discussion. Unfortunately, I think we're
we
approaching
are.
the end of our time. But there is a discussion about what to do to support individuals. A lot of our safety net has been constructed to support families with children, in particular single-headed households with children. It's most generous to those folks. Once you're married, there's less generosity because of the assumption that now two people can work or kind of help juggle childcare responsibilities. And then for individuals, there's not very much out there, but that conversation will probably have to wait for another
day.
time.
Yeah.
Yeah.
So I know, Gary, your team has a report out this week, I think, that we're going to share through the Facebook Live page. And our team put a report out today, our sort of final take on food insecurity during the pandemic, that we'll share along with some other resources, I think, from our centers. So is there anything else you want to add before we wrap up?
No, I don't have anything else to add. I think both the work that Kayla's team has done and the work that we've done at the Price Center for Social Innovation, we are oriented to be working with people who are either experiencing these issues themselves, to learn from you, to work with organizations that are serving people who might be facing insecurity or extremely low income, facing housing insecurity, etc. And so we invite you to tell us what it is that we aren't doing, what we aren't sharing, so that we can actually have systems that work to support, working families and individuals so that they can take those next steps in life, whatever they might be. So it was a pleasure today to share this time with you, Kayla, and I invite others to get to know your work in the future.
Yeah, thanks, Gary. Same here. It was a great conversation. And thank you to the audience for joining us on USC Facebook Live. We'll see you soon.
Bye-bye.
Bye.